Okay. Good afternoon, Giovanna. How are you?
Good afternoon, Alessandro. I'm fine. How are you? How's the
I'm
school
fine.
going?
I'm fine, thank you. Today I'm gonna ask you some questions regarding my understanding of how a physiotherapist in his career and sessions analyzed the movement of a patient.
Okay, thank you.
The first question that I would like to ask you is, what information do you collect as first when a patient comes inside with a movement-related problem?
Okay. First, I introduce myself to my patient, and I ask him how is he doing, and how's his history. So if he had first of all, the reason why he's in the studio, and second, his history, if he had any previous injury or any surgical, any how do you say, any surgeon, and if he did any physiotherapy previously, or is it for the first time? And after that, I ask him about the current situation, where I ask him about the pain and the movement, if there's any movement that he can do during the day. So how his pain affects his daily routine or sleep.
Okay, so basically you're asking us first like a history taking of the patient.
Yes, that's right.
All right. And how important is the patient medical history compared to observing their movement?
But it's very important because I believe that if the patient have already takes a lot of medication, the movement will will already have an impairment also with the actual pain.
All right. And speaking about the analyzing, what key question do you ask the patient before analyze their movement?
First of all, I ask them what are the movement they can make. Then I ask them to do an active movement. And after that, I ask them how is the range and when does the pain start. And after that, I do the passive movement.
All right. Okay, thank you. And you as a physiotherapist, do you prefer to observe the movement globally first or immediately analyze the individual joints?
No, I prefer to observe globally the movement, and I always observe the patient right in the moment as he enter in the studio, because sometimes patient doesn't even realize what are actually their movement or their impairment.
All right. What signs immediately indicate that something is not functioning correctly,
Ah,
for your point of view?
from my point of view, the natural movement. So how if a patient enter for example, a back pain, I usually observe how he sits, or maybe um, how he's doing also the faces, how his expression, because sometimes also there are other traits that can indicate the quality of the movement and also the level of the pain.
All right. And about the posture, how do you observe the posture, the balance, and also the coordination while the movement, during the movement?
Well, the first thing I do is ask the patient to remove all the clothes so I can see, first of all, how his natural posture. And then I ask him to do a little steps on the place
Yeah.
so I can reset the system. Then I observe the trunk or the arms, the legs. I do an observation, and I also touch the patient to see the quality of the tissues. And
Okay.
then I ask to do some maybe test of mobility of the neck or the rest of the spine and the legs and the
Okay.
arms, of course.
Okay. Okay. Yes. Okay. Speaking about the biomechanical analysis, um, how do you identify the weak link within a kinetic chain?
Uh, Maybe observing actually the quality of the movement and if the patients do it slowly, so the speed of the movement, how if he has maybe a fear of the movement, so things like this.
Okay, yeah. And speaking about the principles, which principles do you use the most frequently when analyzing a movement?
The principles, are you talking about the test I do or
Yeah,
okay.
regarding the biomechanical part.
I use lots of tests, especially when I have to analyze the shoulders. And I use neurological tests if the patients come in the studio and has maybe neurological symptoms like an alteration of sensibility or of force.
Okay, all right,
Those
yes.
are the main.
Yeah. And do you use technological tools such as video analysis, sensors, or specialized software?
No, no, because I don't have them in the studio, so I just use the old test
Yeah,
and the movement. I use sometimes maybe the system to measure the balance on the feet,
yeah.
but I don't usually use them every day.
All right. When do you decide to use the advanced tools rather than simple clinical observation?
The VAS I just use it. I use it always at the start of the session and at the end.
Yeah,
And especially on the first session and the last. In between, it depends sometimes.
all right. How do you translate movement observation into a clinical hypothesis?
Uh, I use all the tests and then mm, I try to assemble all the movements I record during the session, and then I try to see other than the pain of the patient,
Yeah,
what section gave me the most positive sign of the test, also with the passive movement or the pain I found, and also the quality of the tissue. So it's a mix of a lot of things.
yeah. All right. For like as a for a physiotherapist in general, how important do you think is to compare the affected side of the patient with the unaffected side? For
I think
example,
it's one of
during the basic function examination.
yeah, I think it's one of the most important things um, because for us, first of all, it's a good comparison to the health sides, but
Yeah,
it's very important to the also to the patient because when they do exercise on the affected side and on the health side, it can he has a good feedback for the exercise, for the pain, for how to do the
yeah,
exercise correctly or the movement.
right, yeah. Okay. Now we have a part about your professional experience.
Okay.
Does your approach to movement analysis change with your experience?
Yes, it changed a lot because once you exit from the school, you have a lot of ideas, you have a lot of lesson learned, but it's another things when you have the experience and the real person in front of you. And I'm also finishing the school of osteopathy, which gave me lots of a global observation of the patient
Yeah.
and not only sectorial. Okay, so it changed a lot in the years.
All right. Are there movement patterns that you recognized almost immediately? Let's say.
Um, I see a lot of compensation maybe when we speak about shoulders. And the first thing I look for is the movement of the neck with the shoulder. Or if they have a back pain, I see how the trunk follows the movement or the legs. So these are my keys.
All right. Um, can you please recall a case where the movement analysis completely changed your diagnosis?
Yes, I see this often with the shoulders, with the maybe an inflammation of some tendons. I often see that they are consequence of maybe a neck pain. So this is the most common that the where the patient answer for the diagnosis, but maybe the movement says other things.
Yeah. All right. Thank you. The last question that I would like to ask you is what advice would you give to someone who wants to learn how to analyze a movement professionally?
First of all, I would say try to always give a personalized look because
An observation, yeah.
yeah, that's right. Because if we take five people with maybe a leg pain or a back pain, they will be always different. So try to be more specific on the single person.
All right.
Okay,
All right.
thank you.
Thank you so much.
Thank you
And
too.
with your answers, I'm more like involved in the pattern, and it helps me a lot to understand how it works in the professional career.
Thank you so much.
So
I'm
thank you
glad.
so much, and have a nice day.
You too. Bye.
Bye.
Thank you.